Learn more on BBC Bitesize.
Hello and welcome to Bitesize GCSE History, where history gets practical, painful and finally a bit more hygienic. I'm Anoushka Lewis, history podcaster, here to talk about the history of medicine. So far, we've survived medieval medicine, the Renaissance, and a worrying amount of bloodletting. Now it's time to step into the 19th century, where medicine starts to focus on something radical: patient care. Less hope for the best, and a lot more wash your hands. We'll explore the key events, people, and concepts for your exams. Right, time to hop back into that time machine. Let's go. We're starting just before the 19th century in 1796 with a discovery that would save thousands of lives: the vaccination. Enter Edward Jenner. Jenner noticed something strange. Milkmaids who caught cowpox, a mild disease, didn't catch smallpox, which was deadly. So Jenner did what scientists do best. He tested it. He took cowpox from a milkmaid and inserted it into a healthy boy. The boy felt a bit rough, headache, loss of appetite, but then recovered. Later, Jenner exposed him to smallpox and nothing happened. Success! Jenner called this method vaccination, from vacca, the Latin word for cow, which means, yes, medicine officially became cow-based. However, Jenner didn't know why it worked. That explanation would eventually come later. Fast forward to 1831, and Britain faced another deadly threat: cholera. Symptoms including diarrhoea, vomiting, leg cramps and severe dehydration. Cities were overcrowded, streets were filthy and waste was everywhere. People could die from cholera in less than a day. By 1854, a doctor called John Snow noticed something important. People using a particular water pump in Soho, London were getting sick. He discovered sewage had leaked into the water supply, proving that contaminated water caused cholera. Yeah, I probably won't drink that. They still had no idea why this was happening, but this was a massive step forward. And if you fancy stepping forward for more in-depth information, be sure to check out the Bitesize website, link below. Now it's time for the microscopic characters of our story. Louis Pasteur was investigating why drinks like milk went off. Using better microscopes, he observed tiny microbes in liquids and worked out that these caused decay. This became known as germ theory. Pasteur heated liquids to kill the microbes, stopping them from going bad, a process called pasteurization. You might know that term from pasteurized milk. And Pasteur realised something huge. If germs could make food go off, they might also cause disease. His ideas weren't immediately accepted in Britain, but they definitely inspired others. Enter Joseph Lister. Lister read about germ theory and applied it to surgery. He used carbolic acid to clean wounds, instruments and dressings, killing germs and preventing infection. The results were dramatic. Between 1864 and 1870, death rates from amputations, for example, fell from 46% to 15%. That is not just progress, that's a lot of lives saved. This is where patient care really begins to change. Around the same time, James Simpson introduced the first successful anaesthetic using chloroform. Finally, they could do surgery without screaming, and many surgeons getting less headaches, I imagine. Chloroform became widely accepted after Queen Victoria used it during childbirth, because if it's good enough for the Queen, it's good enough for everyone. Head over to the Bitesize website for lots more on the history of medicine. It's linked below. Patient care isn't just about cures, it's also about where and how people are treated. Before antiseptics, hospitals were dangerous places. Dirty wards, poor toilets, infection everywhere. Enter a very well-known lady, Florence Nightingale. During the Crimean War, Nightingale was horrified by the conditions in army hospitals. So she introduced simple but powerful changes. Regular hand washing, clean bedding, better food and improved ventilation and drainage. Something that, looking back now, you'd think would be obvious, but it hadn't been. And it worked. Within 6 months, death rates in the hospital where she was practicing dropped from 40% to 2%. Nightingale went on to redesign hospitals and set up the Nightingale Training School for Nurses, making nursing a respected profession. Another key figure was Mary Seacole. Born in Jamaica, she volunteered to help British soldiers, but was rejected by the War Office. So she funded herself, travelled to Crimea and treated soldiers on the battlefield. Soldiers called her Mother Seacole, as she looked after them so well. Together, these developments improved people's understanding of how patients should be cared for. Right, that's your lot for now. Let's head back to the present day. If you'd like to know more, make sure to head to the Bitesize website, link below. So, for your GCSE exams, remember this. The 19th century saw huge improvements in patient care thanks to vaccination, germ theory, antiseptics, anaesthetics, and better hospitals and nursing. Medicine finally became cleaner, safer, and more effective for patients. And that is progress worth travelling through time for. For more revision help, head to the Bitesize website or listen to the podcast on BBC Sounds. And I'll see you next time. Bye!
For in-depth GCSE resources and practice, visit BBC Bitesize now.